So one of the common things that we therapists do, especially in cognitive behavioral therapy, is something called outcome monitoring, where essentially we're trying to figure out and track a person's progress over the course of treatment in terms of their symptom severity. Is this person actually progressing as a result of therapy? And if you're someone who's been working on their anxiety for a while, maybe you've been reading books, you're watching these videos, you're engaging in programs, you probably want to answer the question, how do I know when I'm starting to recover? How do I know I'm progressing throughout treatment or other types of self-help? So in this video, I'm going to talk about some of the ways that you can identify whether or not your anxiety is improving. If you don't know me, hi, my name is Dr. Parky. I'm a clinical psychologist and I've been studying and practicing evidence-based mental health for the better part of a decade now, and I'd love to share some of that information with you. So the first way to know whether your anxiety is improving is by something called the subjective units of distress. So from 0 to 100, how anxious are you, either sort of in general on a day-to-day, especially if you're someone who deals with generalized anxiety, or specific to certain situation, like if you're someone who struggles with social anxiety, how sort of distressed you are in certain social situation over the course of treatment or over the course of you working on your anxiety. So for example, if you've been struggling with generalized anxiety, but you've been working on, for example, relaxation strategies, maybe on the first week, you notice that in general, your subjective units of stress from 0 to 100, 0 being like, no anxiety at all, to 100 being like constantly feeling overwhelmed, was initially at a 70. But then as you continue practicing your relaxation exercises and you've been observing your overall anxiety levels over this week, for example, and it's reduced to a 50 from a 70, then you have a good sense that overall your baseline levels of anxiety have significantly reduced. And you can apply the subjective units of distress to other situations too. For example, maybe in the beginning when you started initially going to parties, the idea of going to a party was an 80 on 100. But as you engage in more and more social situations, became more familiar and comfortable, the idea of going to parties now gives you a subjective unit of distress of 50 over 100 or 40 out of 100. And as a result, you kind of notice the same anxious stimuli, you're noticing the sort of continued progression in terms of habituating to the anxiety and feeling less sort of reactive or anxious about the idea of going into these anxious situations. So they can be social situations, or if you have a phobia of certain animals like dogs, it might be that initially you were like 100 out of 100 in terms of interacting with a Rottweiler, but now you can do it really, really easily because you've been doing more and more exposures. So as you can kind of see, your sort of rating of subjective anxiety reduces over time, which is an indicator of progress in treatment or, in your work in anxiety. So the subjective units of distress is a great way to operationalize anxiety from 0 to 100. It's a really kind of an easy way to do so. But if you're interested in more validated measures of anxiety, there's certain scales like the Beck Anxiety Inventory that you can actually kind of rate your anxiety on various different measures, which allows you to kind of get a sense of your overall reductions in anxiety using a scale that's been supported by the research and evidence. All right, so a second way to know that your anxiety is improving is that you're doing more scary things. So anxiety tells us to avoid, it tells us to kind of limit our life towards all the things that are safe. So it almost kind of like makes our world smaller and smaller. So the idea is that if you're improving your anxiety, you're likely engaging with the world even more. You're going to unfamiliar situations, you're doing different things, maybe scary things. So you're not allowing anxiety to limit your world and make it harder for you to function in your day-to-day, and you're doing more stuff and your world is becoming ever expandingly bigger. So a third way of knowing that your anxiety is improving is that it's no longer just kind of more of a general feeling of like distress and danger, but rather it's tied to more specific events that make sense in the moment. Like it makes sense for anybody to be a little bit anxious about presenting in front of 100 people or going into a party where, they don't know anybody and maybe they're all like scary, famous people. Like all of those things make sense for us to feel a little bit anxious, a little bit more worried, to help prepare us in those moments. But if you're noticing that if your anxiety is just kind of pervasive and it's like well above and beyond anything associated with the dangers of the situation, then maybe the anxiety is a bit more of a problem than it is something that's a healthy adaptive mechanism. So if you're noticing that your anxiety is just kind of relevant to the situation, it makes good sense for anybody to be anxious in those moments, then that's a good sign that the anxiety is reduced, the volume of the anxiety is reduced to a point where it's actually adaptive and normal rather than kind of unhelpful and a little bit maladaptive. And this is particularly important for the people who worry a lot. So people with generalized anxiety disorder will tend to worry all day, every day. They worry for hours on end. And that sort of pervasiveness is sort of a feature of anxiety disorders. So if you're noticing that the worries still come about, but they're no longer completely dominating your life and you're only worrying maybe 10 or 20 or 30 minutes every day compared to hours on end, that's also a good sign that your anxiety is starting to improve. Another sign that your anxiety is improving is that it no longer makes it hard for you to engage in effective problem solving. So for some people who are like chronically worried or catastrophize everything, they're so anxious it's hard for them to get out of this fight or flight mode, but they can't engage in the actual problem solving needed to be able to do the work to reduce their anxiety. Like somebody who's really anxious about presentation might be so worried about it that they feel like frozen in place and they can't get the stuff done. But if you're noticing the sort of a moderate amount of anxiety that makes you think about how do I do a good job, makes you approach the situation to actually do well, then that's another good sign that your anxiety is actually, again, serving you rather than making it harder for you to engage in your effective behaviors aligned towards your goal. And another way that we can understand whether or not our anxiety is improving is how we react to stressful situations, because stress is a normal part of life. But for people who are really anxious, the moment even something small comes up, they kind of really worry. They get into sort of this sort of survival mode. Whereas a person who has improved their anxiety might be able to kind of really say, actually, no, you know what? I got this. I have the resilience. I have the wherewithal to be able to address the issues as they come up. So even if their anxiety spikes a little bit, it's not the same kind of like catastrophe crisis mode as someone with an anxiety problem might have. And a final way to know that your anxiety is improving is that you've started to make friends with your anxiety. And this sounds kind of interesting, but somebody with an anxiety problem usually has a pretty negative relationship with their anxiety. They always feel like either dominated by it or controlled by it. They hate the way that their anxiety feels. Whereas somebody whose anxiety has started to improve, their relationship with it also changes, where they can see the wisdom of the anxiety, where it helps serves them, helps protect them, and they're able to say, hey, like, thanks anxiety for like protecting me and making me prepare for these different situations. But they're not so kind of in a sort of fight mode with their anxiety where, everything kind of feels like a battle. And that's it. Hopefully this video was helpful for you to learn a little bit more about the indicators and markers of improved anxiety, and that you can use that to kind of understand where you're reaping the rewards of your hard work. Thanks for watching as always, and I'll see you in the next one. Bye-bye.